Hi, I'm Herman Houin. I'm a plastic surgeon at Henry Ford Health System in Detroit, Michigan. So I've used DermaClose for probably 3 or 4 years, mostly for fasciotomies and open wounds that I was trying to get to come together. Over the last 1.5 to 2 years, I started to use it in a different way, and that is using it as a pre-stretching to pre-expand skin around a difficult wound. Specifically, the one I've been using on is cranioplasties where the bone flap has been lost, or they've had multiple infections or radiation where you really don't want to be cutting into this tissue. Of course, it started with the ladies because they don't like to have a skin graft in the back of their head, and then the subsequent procedures to take that out. Obviously, when you add in the cost of the multiple procedures, doing it in a prospective fashion makes a lot more sense. Typically, these patients, as an example, the one I did this morning was done in under 2 hours, skin to skin. The patient is going to stay in an ICU for 1 night, but that's strictly for the neurosurgeons to be sure they're okay. And from our standpoint, she can go home tomorrow. So the issue is, we've been able to save a great deal of operative time. Having the skin stretched out ahead of time, it makes them almost like a Shar-Pei dog with a little roll of skin in front of the DermaClose bindings. And then once we release that, we have plenty of skin to put a 3-dimensional implant back in to reconstruct the skull. It's been one of the best uses for this. Obviously, I've used it for the fasciotomy wounds for a long time. It works great for that. I like it for the fasciotomy wounds because you don't necessarily have to put it on in an operating room. Some local anesthesia, you can put it on the floor if you need to. Obviously, if you have the opportunity to do it in the operating room, it's a little more comfortable for the patient. I find that usually within 5 to 10 days, I have enough tissue that most wounds I'm approaching with the DermaClose are able to be closed primarily. Have not had any long-term trouble with excessive scarring because of the tension where the little tags or the grippers are placed. That has, sometimes they're a little red for a little while afterwards, but that quickly abates, and I've had no one complain of it. As far as a cost, benefit for the patient, obviously it's a great deal because they don't have to pay for an indwelling tissue expander. They certainly don't have the cost and pain to come back to your office week after week to have tissue expanders stretched out, and invariably you're going to have 1 or 2 of those a year that'll get infected and they come out and you're back to square one. Very disappointing for the patient and doctor together, and very expensive for everyone involved. The DermaClose being on the outside, there's no buried materials. You can just sit there and watch it do what it's got to do, and then proceed when it's ready. You don't have to plan it 6 weeks in advance that I think I'll have it stretched out enough that I can put you in the OR for that. You pretty much can plan right when you're going to do that. I've already got my orthopedic surgeons and my vascular surgeons already knowing that, hey, if they're going to do a fasciotomy and want me to close it, they're going to put the DermaClose on, and actually they're doing a lot of the closures themselves now because by the time they're ready to call us, it's coming back together. And I will typically put it on my fasciotomies the day we do the fasciotomy. Just put it on. You know you're going to do it. You may not crank it all the way down, but just tight enough that it can start doing its thing, and then maybe the next day come down and crank it the rest of the way and put it on full tension then. So it's been a great way to decrease the number of visits to the operating room for patients.